Welcome to Grand Rounds in Urology's UroEdge Learning Center. I'm Diane Newman. I'm a urology nurse practitioner and pelvic floor specialist. I'm also the senior editorial director of Grand Rounds in Urology. I'm very excited today because I have an expert in sexual health. She is Amy Pearlman. She's a urologist who has a practice in Southern Florida. I've known Amy for several years because she was our resident here at the University of Pennsylvania. And she's going to talk to us today about premature ejaculation.
Thanks, Diane. So good to be here with you today. Hey, folks. My name is Dr. Amy Perelman. I'm a board-certified urologist with expertise in sexual, hormonal, and genitourinary health. And today I'm going to talk about everyone's favorite topic, premature ejaculation. These are my disclosures, and relevant to today's discussion are four in particular. One is I'm on the advisory board for The Coach, which is a men's health app specifically to help men last longer. I'm on the advisory board for FirmTech, for Promescent, as well as for Cadence Bio, which is a novel therapeutic which is hoping to treat premature ejaculation, not currently yet available. When it comes to the current treatment options for premature ejaculation, there are several, but notably there are no FDA-approved therapies for the treatment of PE. Mental health professional guidance is obviously a mainstay of treatment, but I'm not going to tell all of my PE patients to go see a sex therapist or a mental health professional, although it does play a role. First-line medications include daily SSRI medications or on-demand SSRIs, on-demand clomipramine or duloxetine, as well as topical penile anesthetics. Now, I'm not a big prescriber of SSRI medications because one of their limitations is their sexual side effects. And so there's something called PSSD or post-SSRI sexual dysfunction, which makes me very hesitant for me to personally prescribe those medications. When it comes to second-line medications, we have on-demand tramadol, which I've actually never prescribed for my patients, although there is some work that's been done on that therapy. And then our typical alpha blockers that we actually would use for lower urinary tract symptoms. But with those medications, there's limited research to support their use. And you think about one of the big side effects of alpha blockers, which is retrograde ejaculation. So we're kind of like treating one ejaculatory dysfunction and potentially getting another one. So when it comes to treatment limitations, there are several. As I just mentioned, there are no FDA-approved medications or procedures for this disease process. When it comes to mental health professionals, depending on where someone is located around the country, there might be limited access and time. Like, I would love for my patients to see a mental health specialist whenever they're coming in with any sexual dysfunction, but sometimes time and financials can be a limiting factor. And then side effects, as I alluded to with medications like SSRI medications, there are some people that will develop side effects. And in some percentage of the population, people can develop side effects that persist even after stopping these medications. And folks, it's one thing if we start someone on a medication, they develop side effects, and then we stop the medication and the side effects go away. But what if they don't? And that's been described with SSRI medications. And when people have those persistent side effects, we currently have no cure for that. So that's a big concern of mine. And then a lot of these therapies that we're discussing so far, there's limited data to support their use, and they may not be effective in a large proportion of men. For today's discussion, I'm going to go through some modern tools in sexual medicine. So I'll go through some of the research to support their use, and then I'm going to actually show you and give you some hacks or tips and tricks to actually explain to your patients in a way that they understand. And then Diane Newman is going to pick my brain a little bit if she has any additional questions on these products. So let's begin. We're going to start with delay spray. And I think one of the most helpful things that I can do for my colleagues is give my colleagues a place to begin. What are the companies that are offering these therapies? It is not enough for me to tell you or my patients, go on Amazon and get a delay spray, right? Part of my job and one of my more important roles is to go through the available products and find the good ones, all right? So this is part of what this presentation is all about. So Promescent is a delay spray. It's been around for a while, and there is actually some research to support its use. So in this one study, there were over 90 men who had self-reported premature ejaculation, and they used this topical spray. The ejaculatory latency time increased from around 7 minutes to 11 minutes. So that's a 4-minute difference. That's a big difference there. When we look at orgasm rate, we're always talking about this orgasm gap between men and women. So if you look at the guys that were using the delay spray with the spray, orgasm rate for both partners was over 65%. Without Promescent, it was 44%. What we also know from this research is the quality of the sexual experience significantly improved on the days that the guys were using the product. And continued use of this product has led to greater improvements over time. And it's interesting because, when I speak with members of this company, for a lot of guys, they'll use this product as somewhat of a training tool, right, to build some confidence. And the hope is that men over time may no longer need this product. And, that's a win actually for the company and for patients. So I look at these therapies as oftentimes being a training tool for a lot of my patients. It's easy to use, and that's been reported by users, as well as non-disruptive to the sexual experience. So let's talk a little bit about how to actually apply this medication, because if you apply too much or you apply it incorrectly, it's actually not going to be helpful. With this medication here, this is the delay spray. So it comes in a very, small container right here that you can easily travel with. And this is actually made out of lidocaine. And the technology is very important because compared to other delay sprays, there's an important difference with this medication. When you spray it on the penis, the medication absorbs into the penile tissue within like 5 to 10 minutes. So it doesn't get on one's partner. That is key. That's like the number one thing that my male patients ask me is like, am I going to numb my partner? And you won't with this therapy. So in terms of where you're going to want to apply the medication, I tell my patients to start by applying it on their more sensitive areas of their penis, which for a lot of men is going to be on the bottom part, like where that frenulum is. And so I'll tell my patients, go ahead and just apply like 1 or 2 sprays to this area and then rub it in with your finger so it doesn't get messy. Let it sit for like 5 or 10 minutes. If there's any residue on the penis, you can just wipe that off and then you're good to go. It's already absorbed into the tissue. So it's very easy, but don't just go to town and spray all over the penis like you might spray your hair, right, with hairspray, because you're going to numb the entire penis and you're going to completely, mess up the sexual experience. So start with a little bit, just like we would explain to someone with Trimix, for example. Start low, increase slow is what I would recommend for a delay spray.
That's really interesting. How often can they use it though? Like, is there should they just use it once a week or every time they have sex, or how often do you recommend?
So they can use it whenever they want.
So
Yeah,
there's no
whenever they
pro there's
want.
and there's no side effects as far as absorption or anything.
No side effects. I mean, it is such like a minor amount of lidocaine that they're applying. So it's a very safe medication. It's available over the counter. No prescription is needed. And it's people can get it at certain stores. They can get it online. It's very easy to get, very accessible and cost effective and easy
Well,
to travel with.
if they use it though, Amy, and then what if they do oral sex? I mean, that's not a problem then.
Correct. That's not a problem. That is
Okay,
not a
thanks.
problem.
That's really helpful. Thank you.
Yeah, absolutely. And, the important thing about this product is I'm trying to build my patient's toolbox, right? Before they need it. So let's say it's a Friday night, comparing like a Friday night with a Wednesday night, I encourage my patients to ask themselves, what type of sex do you want to have today? Because maybe on a Wednesday night, they're okay with having sex at 7 minutes, which by the way is a very respectable period of time, right? But then let's say on a Friday night, they want to last a little bit longer. That's where they might bring out a spray. Okay.
Okay.
Now, there are other products that will desensitize the penis. Like Promescent also has a delay wipe, but the wipe is not as effective. It's not as powerful as the spray and may transfer to the partner. So that's why I'm a big proponent of the lidocaine spray.
Thank you. That's really helpful.
And then we have a similar product here recently released by Popstar Labs, which is similarly a lidocaine topical spray. And what I've heard, from speaking with the company is that there's no taste to this one. So there's no issue with, giving oral sex after someone applies the spray. Sometimes different products have different tastes, even though they're not bad tastes. And when this company was developing their product, they specifically were like, this product can have no taste whatsoever. And so that's one of the advantages of the Popstar product. All right. So now let's talk about an erection ring. And this one specifically is by a company called FermTech. And it's the one in their product portfolio called the Max PR. And this is actually research. It was a study that I was a principal investigator on. We haven't gotten it published yet, but you all are going to be the first to know some of our findings. So let me show you. I'll show you in a second how to actually put this on, but it's an erection ring. And note, when I explain this to patients and colleagues, I don't call it a constriction band because that's not sexy, right? And oftentimes when it comes to getting our patients inspired to use some of these products, we have to use terminology that actually gets them excited about using them. So I use the term erection ring, and part of the ring goes around the back part of the testicles or scrotum, and that can provide some testicular engorgement, which a lot of men like. It also helps keep the ring in place. And the other part of the band goes around the base of the penis here. Now, this is a one size fits most type of ring, so you don't have to size it, which is different from a lot of the other rings on the market. And so if someone wanted to make this band, let's say, tighter around the shaft of the penis, they can just slide this over this area right here to make it tighter and then looser around the scrotum. So let me talk to you about our research here because it's fascinating. We were looking at detumescence time. Detumescence time is not something that you can even like really find in the literature. There's very little information on it. So as I'm writing this manuscript, the challenge is that it's really hard to write the introduction because there's very little data for me to draw on. So detumescence time is the time from when a man climaxes to when he loses the erection. So if someone puts a ring on their penis, or if they can prolong their detumescence time, it doesn't necessarily treat premature ejaculation, but if they can maintain their erection longer after they climax, that person is still in the game, which is why I think about this product within the potential treatment options for premature ejaculation. So what we did is we looked at guys who didn't use any therapy, right? So each person was in 4 different groups. So no therapy when they were engaging in sexual activity. Then we had them use the erection ring. Then we had them take a PD-5 inhibitor, which they were already prescribed, something like Viagra or Cialis. And then the last situation was we had them combine a PD-5 inhibitor with this Max PR erection ring. And we had them time themselves from the time when they ejaculated to the time when they fully lost their erection. These studies are challenging to do. I can't even imagine being a man asked to time myself in that respect. But hey, we had 21 guys who are willing to participate. So in this study, we had 21 men. They had an erection hardness score of 3 or 4. And we looked at the no treatment, situation here. The average time to detumescence was about 95 seconds, so like a minute and a half. When guys only used the erection ring, that increased to 160 seconds. When they only used a PD-5 inhibitor, that increased to 212 seconds. And folks, when they combine these therapies, so erection ring plus a PD-5 inhibitor, look how much they improved their time to. That's 314 seconds from when they climax to when they lose the erection. So that is a significant increase. So what did we learn from this work? That if you use an erection ring or if you use a PD-5 inhibitor, you're going to maintain at least some blood flow in the penis for a longer period of time. But when you combine those therapies, that's where you get the great results. Now, a big limitation of this work is we don't know if maintaining that erection with some blood flow was still enough to continue, let's say, penetration, right? So it doesn't tell us that they can still continue to penetrate. It just tells us that they still had some blood flow in their penis, after they reached climax. So this is just kind of like a hypothesis generating type of, work right here, and lots of questions and studies that we can do based on that. Diane, any questions about this product?
Yeah, so can you show it to us? I mean, as far as, I'd like to see that. So it goes around the scrotum and then the base of the penis, I'm assuming, right?
Yeah, exactly. So what I would have someone do, and I always have guys, if they're getting it from me in my clinic, or if they get it online, I'll have them bring it in so I can actually show them how to use it. I'll have them stand in front of a mirror, and then I have them just open up this ring right here and just like drop their testicles in. And then what they'll do is they'll then close this over top the penis. So let me show you what this would look like. So they would drop the testicles in here and then just close it like that. Okay, so one piece here goes around the back part of the scrotum and the other goes around the base of the penis. Okay, the nice thing about this product too is it's made out of elastomer rather than the typical silicone, which a lot of rings are made out of. So it's not as tight as typical erection rings, which means you don't have to wait until you get the full erection before you put the ring on. I mean, putting a ring on after you get an erection is literally like a cock block, right? And so if someone can put this on when they're engaging in foreplay or watching a movie or doing whatever, even when they're completely flaccid, it still allows blood flow in the penis and then just compresses the veins to help keep the blood in. So you don't have to wait until that perfect moment, which a lot of my patients appreciate. Now, this is really exciting technology because this is in the realm of TENS unit therapy or transcutaneous electrical nerve stimulation. And we somewhat, at least vaguely as urologists, are familiar with this type of technology, right? Because we know about neuromodulation, when it comes to overactive bladder and PTNS treatments. And so this is just kind of like a similar neuromodulation. Now, typical TENS unit would look something like this. So it has like a box like this. You have some cords here, and then you have these electrodes. Okay. So TENS unit therapy has a lot of research to support its use for all sorts of chronic pain conditions, including fibromyalgia. So if I have patients that come in and they're looking for conservative approaches for, let's say, their low back pain, I'm oftentimes counseling them on getting a TENS unit. Now, this is when I was working at the University of Iowa, and I was working closely with our pelvic floor physical therapists, is they were actually working with a lot of my male patients with Parkinson's disease and overactive bladder symptoms and using TENS therapy to treat their urinary symptoms. And when that works, that's a real game changer because then we don't have to use medications, which certainly have side effects in our patients with Parkinson's. And that's really what kind of opened my eyes to the possibility of TENS units being helpful. Also, when I was at the University of Iowa, I was looking at TENS units for chronic scrotal content pain. So now there are two companies that are looking at this technology to see if they can neuromodulate the ejaculatory reflex. So one company, and this product is FDA cleared, it's called the IN2, and they've done research using this product. So in a prospective multi-center, international, sham-controlled, randomized, double-blind study, that's a mouthful, they had 51 in this study, 34 in the active treatment group, and 17 in the sham group. And they were able to increase the intravaginal ejaculatory latency time from 67 seconds to 123 seconds. So that was a significant increase. And I know that doesn't sound like that much, but to go from 1 to 2 minutes is a big deal for guys who are dealing with like true premature ejaculation. When we look at the sham group, there was an insignificant increase in that time that they were able to last. So let me show you exactly what this product is. This is the patch right here. It's a disposable patch. And you can see if you compare it to a typical TENS unit, there's a big difference. No one's going to have sex wearing a product like this, right, with the cords. And so they've miniaturized this whole technology. And you just take the sticky part off the back. You would need to trim the hair in the perineum so it can actually stick to the tissue. But you're putting this in the perineum between the back part of the scrotum and the rectum. And there's a little button right here, which is I don't know if you can see it, the power button. And you just push this right here and it turns the device on. So I recently actually put this on my arm so I could feel what it feels like. And it's not painful. It just feels like a tingly sensation, like when it's on. And that's how it works. So it's super simple. It's very discreet. It doesn't require medication. With any of these therapies that we're discussing, first of all, they're all available over the counter. They don't need a doctor's prescription, but our patients are going to be coming to us asking us for advice. So that's why we need to know about it, even though they don't need a script from us. But I always recommend that our patients try these therapies when they're by themselves first, right? So they know, does it work? Let me try it out a few times. Let me get the settings right, the number of sprays for the delay sprays, so that when they're actually with their partner, they know exactly, how to use it. The nice thing with this too is, again, you don't have to wait until you're like ready to climax or until you're in that sexual, environment. You could put this on at any point in time before you anticipate any type of sexual experience, and then you just turn it on before you're ready to actually engage. But you would wear it the entire time that you're engaged in sexual activity rather than just when you're about to climax. When I put it on my arm recently, it lasted, I want to say, about like 15 minutes. So once you're done with this, it's done. You throw it out the next time you would use another patch.
Yeah, this is really helpful because you're right. I use electrical stimulation and TENS units with lower urinary tract symptoms. But again, does a patient do it every day? Like, I tell patients to do it at least daily or twice a day. how long do they do it before they actually maybe see some, some really good erections?
Yeah. So it's going to take them a couple tries, right, to see if it helps them last longer during an intimate experience. I tell my patients the first time you use it, it's not going to work. Just like the same time, the first time we put a TENS unit on for back pain, it's probably not going to work. They got to try it a few times and they have to be patient in that process. But it's
And
not
they
something that I'm like retraining them. We don't have data for that. It might help retrain their bodies. I don't know over the long term. So these therapies that we've discussed so far are going to be on-demand therapies in the moment to use to last longer.
so they actually use it during the sexual activity?
Mhm.
Oh, okay, that's what I didn't get. So that makes sense then, yes, because that with stimulation, it should assist with an erection. Okay.
Exactly.
And really it does make sense because we use this for incontinence and that. So there's electrical stimulation or which is what TENS units are, have been applied in many, many problems. So I think this is a really good thing to do. Thanks.
Yeah. And it's interesting because when we think about the pelvic floor and the ejaculatory reflex, people have so much control over their pelvic floor. They just don't know it yet. So the first thing is they first have to understand like what is their pelvic floor? Why does it matter when it comes to their urinary symptoms or ejaculation symptoms? And then how do they target it in a way that makes them comfortable? But I could even see guys if I'm building someone's toolbox where they have, some of these TENS patches and they have a delay spray because let's say they're going out with a new person, they're not in a monogamous relationship, they may not feel comfortable putting a patch on.
Right.
That's where they might want to use a spray, right? So it's really
But
different
you're
things.
giving them options, which is really what's so very important. And the thing is that, if just work in the pelvic floor, Judd Moll years ago did a study looking at men post prostatectomy who had erectile dysfunction. And just by working the pelvic floor muscle, they improved their erection. So that's probably what you're doing with these units, especially with a type of TENS unit. So I think this makes a lot of sense.
Yeah. And on that vein, this is a product, the More product, which is also FDA cleared, which is another TENS unit technology. Theirs is a little bit different. So this is, I'll show their patch in a second here, but it actually connects to someone's smartphone. And this one, the person can actually change the settings to what might be most beneficial for them. And this technology right now is used for men who want to improve their sexual experience, which is it's a very open indication for using this device, right? It's not right now like on label for premature ejaculation. And so, both the IN2 and the More, I have like several of my patients currently trying it out so I can get feedback from my patients to see in which situations might these products be helpful. But this one is different from the IN2 in that you can change the settings yourself. So let me show you what this patch looks like. This is the patch right here. So this one, you have a disposable patch, but you have a battery right here. So you would recharge this battery and then you would just connect it to a new patch each time. So all I'm doing here is putting that on. And then this patch is a little bit bigger than the other one. And when I take this off, you can see where the current is delivered. Okay, so these 4 areas. And so what the smartphone application allows you to do is to actually change the current in each of these 4 different areas, depending on what might work best for people. There's also one that will kind of like cycle through all of them. And I recently put this on my arm and kind of felt what all those different sensations feel like. And they all feel very different, and you can increase the intensity to where you're feeling it, and it's great. So this one allows you to alter the current. Okay, so now we're going to talk about masturbation trainers, and the MyHixel is the one that I recommend to a lot of my patients. And this was a study, it was a multi-center randomized controlled trial, and they looked at 40 guys who had lifelong premature ejaculation. Now, using this device alone is not enough. So I would never just recommend that my patient get a masturbation trainer without any sort of additional guidance on how to retrain their brain or their body. In this study, they looked at comparing men who did cognitive behavioral therapy, so within this like sphincter control program, training program, plus using this device versus just cognitive behavioral therapy alone. And they found that when you combine these therapies, the trainer plus, cognitive behavioral therapy, you get better results. So why might that be? Well, let's look at what this device actually does. This is the device right here. So you can see it looks pretty cool, right? If this were just like sitting on a night table, I wouldn't think anything of it. I would say, oh, that's a cool art piece. So I think that's part of the innovation behind this design is it doesn't look so medical. So you take this part out here. This is actually the heating component. This will heat this material to the temperature of a vagina. So what this is doing, it is mimicking a vagina. So a man can practice, can train on something that feels like a vagina so he doesn't have to train on his partner. Now, this part here is reusable. So if the person would just take this out after he uses it and can just wash it out here. Now, on the inside, let's take a look at the inside here. So we have something, I don't know if you can see, if there's something right here that will vibrate, okay? And there are sensors in here. So no cords, but there are sensors in here that will track motion. So similar to the previous product we were discussing, this is what I would also consider to be like a wearable device because it allows us to track things without actually having to time ourselves. So it would connect via Bluetooth to someone's smartphone, uses the sensors, and can track how long someone is lasting using this device. And the nice thing about this application as well is it gamifies the experience. So it helps make this whole process of retraining one's body a little bit more fun. So the inside here is actually designed to resemble the inside of a vagina. So the person would use this to masturbate with, and he would use this in combination with the CBT to retrain his mind and body to last longer.
Can I ask you a question on this?
Yeah.
This is really fascinating. So how would that help premature ejaculation? I'm missing something. So you're just saying to just work on erections, orgasm, and that will, help prolong the ejaculation. I'm just not sure the connection there.
Yeah, so oftentimes these guys within, like 30 seconds, a minute or 2 minutes of being in a vagina, they're climaxing.
I
And so if
see.
they want to train themselves to last longer, they're going to use this product that resembles a vagina, but use technique with like the movement of their body and everything to like prolong that sensation of reaching their ejaculation.
I see. So it's like really like really a training tool. This is really good,
Exactly.
right?
Exactly.
And
And
then
yeah, go ahead.
what about the cognitive behavioral therapy though? What component is that part of this then if the one man was going to try this?
So that's all part of the smartphone application. It
Oh,
walks them through this whole process, which is great for you and I. Why? Because we're not mental health specialists. We're not trained in cognitive behavioral therapy, right? And so I can use this app and this technology, and my patient can train himself in the comfort of his home and doesn't necessarily need to see, let's say, a mental health provider or to see me to learn those techniques.
this is really exciting because I mean, I'm trying to do some of this work with cognitive behavioral therapy and conservative treatment for lower urinary tract symptoms. So the combination I think is really positive on this device. I
Yeah.
think that's the way to go.
Absolutely. And the company has worked, like they're working with sex therapists, right? To learn
Hmm.
how do we get people to learn how to do this on their own at home. And we, in urology, we need exit strategies. We need to be able to give our patients a suggestion, but not have them then sit in our office for an hour and teach them how to do it. Plus, with this, it's out of our area of expertise. So the company has really taken that out of the office, which is great. Yeah.
Yeah, it's really, really nice. Thanks.
Now, this is something compared to the ones that we've discussed before. This is for someone who wants to retrain their body so that maybe a year from now they don't need any therapy. So I
Mhm.
look at these treatment options in two different groups. What is someone going to use on demand? And then how might someone retrain their body so they don't have this issue in the future? And ultimately, to get the best results, people would use all of these things that we're talking about so far. I have plenty of guys that I know would benefit from using a masturbation trainer, but they just don't want to put in the time, right? That's where they just may say, I'm just going to use a delay spray when I need it. And there are other people that say, I don't want to have to use a spray or a TENS. Let me retrain. And that's where cognitive behavioral therapy and a trainer can be helpful. Same thing with seeing a sex therapist. If my patients see a sex therapist, I'm trying to like cure this for the rest of their lives, right? So between this and like sex therapy, those are going to be more of like the chronic long-term solutions.
Well, and the thing is, I think so important about what you just presented is that you're giving them choices.
Mhm.
And not everyone wants just one thing, and they can choose. So the decision making is really shared. I think this is really exciting.
Exactly. And then we have this product here. This is a product out of Japan. It's called the Men's Training Cup Keep Training Masturbation Aids. And it's similar to the MyHixel in that the goal is to resemble a vagina. Now, this is different in that they are disposable, okay? And they come in different sizes. So it depends if someone wants to retrain their body to last longer or orgasm sooner, because we'll talk about in a different, talk about delayed ejaculation. So if I open this up here, I'll show you what we're looking at. You take the top off here, and this would be a disposable training cup. So this would be the part that resembles a vagina, and they would use this as a masturbation sleeve and then just discard it once they're done with it. So if someone is trying to last longer, then what they would do is they would start with a cup that's larger. And then as they're progressing, they would make their way down to the smaller one because that's going to be the more difficult cup to maintain, to last longer in. So that's how it would work for guys who want to last longer. Now, using these cups alone, again, is not enough. There's a training program that goes in combination with this, again, to retrain that person to teach his body how to control his ejaculatory reflex. This is just a tool to do that. So those are all the products, that we have for premature ejaculation. I think there are way more products available than people believe that there are. Again, none of these medications or products are yet to be FDA approved for the indication of premature ejaculation. But folks, everything I showed today has an incredible safety profile. So if we're thinking, what are we going to start our patients on first line? I would encourage you to think, even though we're used to prescribing SSRIs, and even though those can be helpful, our patients would benefit from learning about options that don't have potentially, long-term side effects. And that's where I would encourage people to have this discussion more as first-line therapy.
And I really appreciate you giving us this information because you know that men are searching and they'll come in with something they find on the internet. And we sit there like, we don't know what they're talking about. We're not informed about these things. So that's really why I wanted to have you on to talk about what can be done with premature ejaculation. And sometimes we don't even ask them because we don't know what to offer. So
Yeah.
that's why this information is so very important. So thank
Yeah.
you so much.
You're welcome.